So welcome everybody to this Family for Every Child online event where we'll share diverse efforts taking place in the United States to reform the foster care and wider child welfare system in favour of family-based care and family strengthening. With you, we hope to also explore how this learning can inform system reform efforts in other countries around the world. A very warm welcome to our special guests for this event, Dr. Amelia Frank Meyer, founder and CEO of Alia, and Jennifer Daly, Senior Attorney and Dependency Project Lead at Family for Every Child member, Legal Services for Children. You'll hopefully have had time to view their presentations before joining today's question and answer session. We're using the Zoom webinar today, and my colleague Georgina is on the Family for Every Child account in case you have any problems using the technology. And to ensure everyone can participate fully, even if their internet's slow, only the microphones and videos of the presenters will be on. So when we start the Q&A session, you'll need to type your questions into the Q&A box. So to introduce Family for Every Child, we're a global alliance of national organisations working on goals of preventing family separation, strengthening families, and ensuring high quality alternative care when needed. We've recently launched 2 campaigns. United for Boys encourages individuals and organisations to sign up to a charter on protecting boys from sexual violence. Childhood on the Move looks at which children are on the move and what interventions can address their care and protection needs. And today we launched our newest publication, The Paradox of Kinship Care, which is a global study and a great read. So now to introduce our 2 speakers. Amelia Frank Meyer is the founder and CEO of Alia. Alia is working to prove that child welfare agencies can serve to keep children safe with their families, not away from their families. Amelia has worked with the University of Minnesota over the last 15 years to develop tools to assess youth connectedness and well-being and to train leaders in a new way of working. She's received numerous awards and fellowships and has presented a TED Talk on the human need for belonging. Jennifer Daly's work at Legal Services for Children focuses on bridging the information gap between direct service providers and policy advocates and ensuring accountability within the system. In addition, Jennifer maintains a high level of expertise in a broad range of legal issues that impact the lives of young people in foster care, which enables her to provide training and technical assistance to other practitioners. Thank you very much for the interesting and inspiring presentations. To help people who watched them a little while ago or didn't find the chance, I'll briefly share a few highlights from each. So in her presentation for today's event, Amelia provided us with a powerful call to action to transform America's child welfare system, which currently focuses on removing children from harmful parents into alternative care, but without at the same time working to help those parents to provide safe, loving, stable care so that children can return home. She also shared how Alia is approaching efforts to advocate for a complete overhaul of the child welfare system. In Jen's presentation, she talked about California's reform of the foster care system, which started in 2015. A part of this is the Quality Parenting Initiative, which introduced professional foster parents with a full-time salary to support the most vulnerable young people. Another part is an adaptation to the regular meetings for individual cases that can now involve anyone the child and family thinks can support them, which is allowing young people and communities a much stronger voice in decision making. I should also say that our presenters have shown incredible commitment to this event, both having prepared for it while recovering from some ill health, and today joining early in the morning. So an even bigger thanks than normal to Jen and Amelia. Okay, so I'd now like to open the question and answer session by inviting participants to share questions. Please use the Q&A box rather than the chat box, as it's easier for us to keep track of your questions and also to make sure that we've responded to them. And if your question is from one of the speakers in particular, you can say so when you write the question. So I'll start by sharing a few questions to get us started. So Amelia, when we keep more children at home, what do we know about safety outcomes? So that's when we keep more children at home, what do we know about safety outcomes?
Thanks for the question. It's often the first thing on people's minds when we talk about keeping more families together. We are currently undergoing a thorough analysis of all the jurisdictions who have increased the number of children living at home with their families. However, our anecdotal information is that they are at least as safe, if not safer. And so we're putting that data together now that we have the initial data about who stayed home and who didn't. I do want to say another word about that, though, and that is that we're looking at a larger question of risk and safety and working with our federal government to further define risk and safety, because we are the only field that is expected to get it right 100% of the time. And if it's not right 100% of the time, we are prone to going way back to how we did things a decade or more ago. And so we're really interested in looking at the full breadth of data, because to think that children are safe in care is really also not accurate in its entirety. Children are also harmed in substitute care. They're also harmed in institutional care, and they're also harmed in homes where there is no child welfare intervention. And so we are working with a group of the federal government to take a broader look at risk, to say, are children safer when we put in place the supports we need to keep them with their parents so their parents can safely parent them than they would be in out-of-home care with unknown or unrelated people in either institutional or even family care.
Okay, that's really interesting that you're working at so many levels to look at that issue, collecting the data as well as advocating for changing ways of understanding things. Okay, so let's move on to a question for Jen. Jen, can you share more about what the mental health components of the reform system in California look like? And in the meantime, just encouraging participants to share their questions in the Q&A box.
Thank you, and thanks so much for having me. I'm really enjoyed joining this training today. The main components that I want to highlight is, first of all, that any child who's in a group home, because they need to be in need of group home services, there's psychiatric services right at the group home, as well as an array of mental health services. But prior to the legislation, group homes did not have to have on-site mental health care clinicians. So that's a big change. One of my favorite changes is an acknowledgement that after-school activities and extracurricular activities like sports or arts actually are very important for a youth's mental health and socialization. So there's written into the law is a need to promote that and to make sure that children have the financial ability to attend those type of activities. In addition, in the Bay Area, many youth are placed an hour and a half away from San Francisco, and so therapists now travel within 90 miles, which, because youth unfortunately are moving a lot, that makes a big difference. Children don't have to change therapists, every time they are moving. And in addition, when children step down from a group home to foster home, their clinicians stay on through the transition period, which might seem like a small thing, but there's so much instability when a youth goes from the type of care that you get at a group home to a foster home, and having those same clinicians, I've seen it have a huge impact on easing transition for youth. There's so many components, but those are the things I can highlight.
That's really interesting, and I'm sure participants might ask you to pick up on some of those. Some of them seem like small changes, but I can imagine in each child's life it's quite major. Okay, so let's move on to another question to Amelia. So what would need to happen to make the unsystem possible? Or we could say, what are the first steps in building this new way of working?
You know, surprisingly, we thought there would be a lot of doing steps, but really the initial steps are around changing people's minds and hearts, because when we think and feel differently, we do things differently. And so when we started by trying to change practice, we quickly learned that until people understand the importance of children remaining with their families in order to thrive, the developmental needs that are met by growing up in part of your extended family and community, if they didn't really believe that, then their actions didn't align with that. And so the first steps that we take are really around two components. One is helping the workforce to thrive, attending to their own well-being so that they can come out of really being in kind of a survival brain where they can barely think because they're so overwhelmed or so burned out that all they can think about is their own need, and they can't begin to imagine taking on change or worrying about someone else or doing things differently. So we do a lot of workforce well-being as first steps. And the second is really what we call mindset shifts, which is helping people understand the science, helping people understand the story, helping people understand the reasons why this shift is happening and the importance of it happening. So when people begin to understand kind of the urgency around it, when they begin to understand that we have no evidence to continue our current way of work, and you can show them evidence from the research, from the social return on investment studies, from the outcomes of youth and family, from the voices of people who have lived through the system. We have no evidence to continue on this pathway, so something must change. When people come to that kind of aha moment, that mindset shift, then the shift begins to happen in the daily moments of interaction without a significant model or practice shift. People begin to behave and interact and respond in significantly different ways.
So interesting. So it is a mindset shift rather than necessarily kind of tangible changes that need to be made. Okay, well, let's move on to another question for Jen. So what do you see as the biggest challenge to implementing the continuum of care reform in California?
Well, the entire reform is based on the premise that we are going to be able to recruit and retain foster parents, because really it's about placing kids within homes and within their communities. And it really is a challenge. I think that there's been a shift from people being open to fostering kids. I think there's a lot of fear about fostering, and there's also just an incredible lack of resources. If the youth needed group home level care before, you could imagine the type of resources that a family would need to support that youth. And so we're just not seeing people stepping up to be foster parents. So the answer to that is trying what I spoke about in the training is this whole new, marketing, so to speak, effort to educate people about the need and about the support that can be in place, and kind of the reward of being a foster parent. So I think that's the infrastructure is not in place right now because there's not enough foster homes. So we're really struggling a lot with that.
Okay, so there's sort of a supply and demand issue, which I think Amelia picked up on in a slightly different way in her
right
presentation. So it might be interesting for her to pick up on that again in her response to the next question, which was going to be, what is the role of foster parents in this new way of working in unsystem? But also I'd say we haven't got questions coming in yet from the participants, so I do highly encourage that if people have questions for them to share them. So over to you, Amelia.
So the role of foster parents in a new way of work, I'll piggyback on Jen's last summary there. So, we have a critical national shortage of foster parents and have for some number of years. And the federal government has done studies on what gets more foster parents, and they found, frankly, none of the interventions work. So trying to recruit more foster parents does not result in more foster parents, and they've studied campaigns all over the country. And so you're right to say that I approach this supply and demand thing in a slightly different way. We have a shortage of supply of foster homes, and we're trying to fill the need for the children by filling that need. But really what we're hoping to do, and where foster parents also play a critical role in the future, is to reduce the demand, so reduce the number of kids who need them, because we cannot find enough people to house them. And so we've got to work on the demand side of how do we help more children to live safely at home. And the answer to that question is really another question, which is how do we help more parents to be able to raise their children, right? How do we help parents to safely parent? And right now our whole system is set up around providing services to children or therapy to children, removing and rescuing them from bad situations, and attending to the child with intervention, while really disregarding the parents or the family. And what children need most is for their parents to be okay. And they will exhibit extreme behaviors because of that disconnection, because of that unhealed relationship. And so the children's behaviors get more severe as we disconnect them, and then fewer and fewer people are willing or able to manage those behaviors in a home-like setting. And so the role of foster parents, and to be clear, you know, I ran a treatment foster care agency for 16 years. So half of my career has been about recruiting, training, supporting foster parents. And so I have in 90 different counties in 2 states. I've got a lot of experience working with foster parents, and I have a strong regard for what they do. However, historically, we've used foster parents as a first-round intervention. So when a child's removed, in what home can we place them? And we're really shifting that role to be a different role, which is after we have done exhaustive search of the child's family, after we have brought to bear everything we can to help the parents support the healing of their own trauma to be able to parent. So after we've done what we can in this family and exhausted the network of people who the child knows and loves or to whom they're related, there will still be a small number of children who will rely on the care of foster parents. So we definitely need a smaller number, which is good because that's what we have, a smaller number to care for children in that situation, or to care for them in the temporary while parents are getting the support they need to heal their trauma so they can parent. Another piece of the foster parent work is that foster parents know how to handle challenging behaviors in family and community setting. And so I expect that our foster parents will take on a much more significant and deliberate role in mentoring and supporting parents who are trying to parent their own children. And I am relying on foster parents, and in sort of my dream vision, they will help to build a more compassionate and empathetic community. They'll help community members and legislators and others see that these are not bad parents, that people don't have kids hoping to harm them, but something terrible has happened to them, and they are, hurt children in grown-up bodies who are now acting out their own pain. And so to build a more compassionate community where we have significantly greater supports to help parents to safely parent, not just remove, isolate, and treat children.
So you've sort of touched on the next question I was going to ask you.
Actually, before we move forward, may I just make a few comments? So I really appreciate the comments by Amelia. In my experience over the last 20 years, we have moved in California away from removing children. I think it's been a huge shift, and I think it's been really good for my clients, both youth and parents. When I used to represent parents, and I would say, this is anecdotal, but I'd say most of my clients were foster kids. So we are just, it's just a cycle. And so we didn't do a very good job. And then as soon as they become adults, we decide we're not going to support them anymore and to have their children back. But there has been a shift, which has been really really great to watch. And there's now, services, they call it the voluntary services unit, where a case comes in and it doesn't even have to come to court. And they work really in depth with families. Of course, I wish that unit was more resourced because sometimes we can't get clients in that. But I think this, the voluntary services unit is the most important service unit we have here with California, San Francisco CPS. So I really appreciate, those comments.
Yeah, and Jen, you're right. In California and throughout the country, there's a strong move to reduce the number of kids coming into care, and so not the least of which because there are no places to put them. There are several states who are using institutional care for children who are nowhere near institutional care because they can't they can't place enough children and recruit enough foster homes, and so it's another reason why we've got to be supporting families to parent their children. But I really appreciate the movement in California especially, but around the country.
Great. Okay, well, let's move into some of the questions that are coming in from the audience. So we've got one which is, I would like to know about the key criteria for foster parents. How can someone become a foster parent in the United States? So I'll pass that one to each of you in turns, maybe Jen first and then Amelia.
Yeah, I mean, Amelia might be better at answering this because I can only answer in California. So, I mean, maybe I will defer, and then if there's specific questions about California, we can come back to me.
Okay.
And I'm sorry, I had a hard time hearing the question.
Oh, sure. Okay. So it was whether there's criteria for foster parents and how people become a foster parent in the United States.
Yeah, it's a heavily licensed area of our work, so it's highly regulated. And there absolutely are criteria which vary from jurisdiction or state to state, but they require background checks, they require significant amounts of training, they require home visits, they require home studies where a social worker goes and meets with the family and asks about their history, their parenting style, their finances. Pretty significant level of intimacy in the question asking to complete a home study. So yes, there absolutely there are. And I will add, there is also a movement in our country to do non-licensed foster care. So kind of an agreement between parents that is being organized by churches in the US, and those homes are not under the same level of regulation, but there are more of those coming forward, in particular for our teenage and runaway youth, but and for youth who identify as LGBTQ, who there are large kind of host home movements, is what they call them, and so it'd be families who agree to take children in who have been set outside of their home for various values, disagreements with their families, or other challenges. So yes, the kind of the main system is highly regulated, legalized, but there is an informal system building momentum.
And so I guess that comes into questions about risk as well, risk to the foster carer or to the social worker arranging those non-licensed arrangements. How is that managed?
Yes, it's a non-government involved arrangement. And so there, as you might imagine, people have a lot of different feelings about them. But because there's a lack of homes, and because kids are really, literally homeless or living in institutions, it's a movement I think that has sprung up to fill a need. But and the most organized, and there's so many of those that are more informal through church and other community networks, but the most organized is called Safe Families, and so that'd be something you could look up and learn more about.
Great. Okay, thanks for that. Okay, so moving on to another question in the chat box. We've got, is there any distinction between kin and non-kin foster care? And can foreigners foster children in the USA? It's quite a specific question.
You want me to take that one, Jen?
I'll take it for California, and then you maybe.
Okay, go.
Okay. Yeah, so there's there's no distinction anymore. That was a big part of the reform. There's no distinction between non-kin and kin foster parents at this point. Kin foster parents used to receive less funding to care for kids. So that was a great change in the law. And in California, absolutely anyone could foster a child, whether they're documented or undocumented or from another country, whatever their status is, you can foster children in California.
That's a really interesting answer. I wouldn't know how to answer that one, and that's so interesting. So I would say in most jurisdictions there is, and the federal government measures the difference between kin and non-kin. So they are tracked and considered and licensed and have different requirements in most jurisdictions. The movement that is happening is trying to get kin care providers paid at the same rate as non-kin providers. And in many jurisdictions, kinship parents do not need to be licensed, so they don't have to go to all the training and do all the licensing requirements, but they are either unpaid or paid less. And I would say the trending is to license kinship care providers so that they can have access, because if you're unlicensed, you don't have access to the same level of federal funding. So to pay them the same as non-kin providers, there's a movement to kind of equalize them, as you heard in California, by making the requirements and therefore then the payment similar.
Mm. And then does that not bog the system down with more administration? Well, that's something we've seen in South Africa.
I could say in my experience, it does a bit. Relatives have it used to be a lot easier to place with relatives. Relatives have to go through a lot of hoops, and that's the downside. And it's been unfortunate. We've lost people, foster parents, who are interested because of some of the hoops. But on the other hand, once the families that do complete the process, they're approved to adopt right away. They have a full adoption study in the beginning, and the most significant is they're paid significantly more to care for the kids.
Well, that actually links to a follow-up question, or another question, which is there any relationship between adoption and foster care?
Mm-hmm.
I'll just, because I was just talking about this, I'll just take it, and then because again, I'm sorry that I have to stick to my jurisdiction in California, but now there is, because now in California it's the same process to get approved for adoption and for fostering. So that's only been in the last 4 years
As part of this system.
To be clear, California generally leads the country in some of these reforms. So what Jen's describing is kind of our leading trend, but what she's describing is not true in most of the states. It's the place I think we'll all end up, but it's not where folks are right now. So there are different licensing processes and different requirements for adoption and foster care. And ironically, in the state I live in, the Center for Child Protection Reform just did an analysis of this, and it's significantly easier to adopt a child than it is to foster. So there are way more requirements to foster than to adopt in the state in which I live. So, which is an interesting thing that they're trying to change. But definitely there's a lot more work to do to get into alignment to those two processes, and they are right now largely different in many jurisdictions. And we also have something we call foster to adopt, which means that when you take a child into placement, you already meet the requirements for adoption, and the intention is that you adopt the child that you're fostering, so you foster them while the adoption process is happening. So they are definitely related, but in many jurisdictions have separate processes.
Okay. If anybody finds they want to clarify any of the responses, please do ask a follow-up question in the chat box. Okay, so a few more questions in the Q&A box, and I've also seen one in the chat box there. So one specifically to Amelia is, it must take a very long time, years maybe, to work with parents to be able to help them to parent safely. How is the child being supported during that time if they're still with their parents?
Yes. So our kind of statement is that we want to avoid out-of-family placement. So sometimes a child, for their own safety, has to come out of the home, but we would like them to be living with family during this time. It takes much less time than you might imagine in many cases when the proper supports are available. The reason it takes so long now is because we remove the child, which is really a primal wound, and then we say, and now meet all of the requirements in the depths of your despair without any support or help, or maybe we give them a phone number or a referral of a place to go. But there's no real support to parents around their trauma. And when you can engage in a trusting, secure relationship with a parent to help them to attend to their trauma, it goes more quickly than you might imagine. But in the event that the child cannot live safely at home during that time, we would want to absolutely, if at all possible, maintain that connection and maintain strong contact between them and continue to preserve and strengthen that connection and bond. And then our greatest hope would be they'd be cared for by someone in their family. And if their family wasn't available, I mean, our greatest hope is by their own parents, and then someone in their family. And if someone in their family isn't available, then someone who we call an already trusted adult, who is someone who they know and love or to whom they are related. So generally someone in their community who has already developed a trusted relationship with them.
Mm-hmm.
So also, I'd love to answer this because so I've been representing kids for about 20 years. And I think it all comes down to how you define safety. I mean, it's a lot about what Amelia is saying, but there's a lack of safety in removing a child from their primary attachment. So you really have to weigh what your definition of safety is, because a lot of these youth who are being removed, it's based on the fact that there's neglect or poverty issues or substance abuse, and the things that they're facing at home. I think there's bigger challenges sometimes by being placed in a foster care system. So I think that, yeah, we always say, and it's controversial, you don't need to have a parent, they don't have to get a grade A, you just have to have them have a passing grade. And I think what I've seen and what I've studied is that is actually much healthier for kids than being pulled out of their primary family.
Mm-hmm.
Absolutely. And we have a research brief that supports that. So it's the evidence against family separation. All of the research supports that. Thank you for saying that, Jen. And that is, I think we have really misunderstood the standard of safety. A child is never less safe than when they're outside of the care of their primary attachment figure, outside of the care of their protector, because even, more than 80% of our kids come in for neglect. And as Jen said, we've criminalized poverty, right? So it's a no-win situation for parents, and a very small number come in for actual abuse. And even children who are being abused are sometimes protected, whereas children who go into institutional care, who have staff unknown to them, in and out, or even into family care, they are in very vulnerable situations. And so I think a big part of this work, as we kind of opened up with, is rethinking risk and safety and getting clear on safer than what, or harmed in what way, because we've really only measured physical safety, and the psychological and emotional and relational terror that happens when a child is disengaged from their primary attachment figure and from their family has lifelong predictive harm, and we seem to forget that.
Okay, nice to see you both so much in agreement and so passionate about the issue. So there's a few more questions in the chat box to go through. So one is, who's responsible for recruiting foster carers or providing foster care services? Is it the state or is it a shared responsibility?
Do you want me to take
I'm
that?
sorry, I'm for some reason having a hard time hearing that question.
Oh, okay.
Yes.
So it's
Much better there.
who is responsible for recruiting foster carers or providing foster care services? Is it the state or is it a shared responsibility?
Yeah. I mean, Jen, you can answer for California. I think there's different answers for different places.
Yeah, I mean, it's a county specific responsibility, but it's funded. The funding comes down from the state in order to provide the services. The state provides, technical assistance, so to speak. So I would say it's a shared responsibility here in California.
And in other places, it depends if it's a state-run or county-run system, or if they privatize the system. So sometimes the state pays a nonprofit to do it. And as part of their, for example, when I ran the treatment foster care agency, we did not get paid to recruit families. We got paid when children were placed in families, and we did the recruitment from the reimbursements we received when children were placed in families. So that was an expected part of what we did. So it does depend. It can be the jurisdiction, be that state or county, but there's often private or nonprofit partners who are part of that equation.
Okay, thank you. So the question in the chat box from, I'm just trying to have a look at that one. So it's from Alia in Egypt, who's one of our member organisations, who's trying to advocate for foster families for street children as part of the national system. The national system doesn't include street children, only orphans. So she wants to know how to select families and how to prepare the concept of in itself to children. So how to just, I guess, to start really, but for a very specifically vulnerable group. So I don't know if either of you have insights to share there.
Jen, you want me to take that?
Yeah.
Okay. Well, first I want to say hooray to you for trying to attend to these children who look like they're falling between the cracks here. And in selecting families in host homes, which is the informal network that is sometimes used in some places in the U.S., they do background checks. They do governmental background checks, criminal background checks. They interview them. They go to the home. They may use some assessments. There's some parenting assessments they might use, but really it's the social worker ensuring the place is safe and meeting with the parents to ensure that that's safe, talking about the environment and their parenting practices, and so really doing a social work assessment with that. In preparing the concept itself to the children, I'm not sure how old they are. We struggle when youth get to teenage years because they don't want rules or structure or connection. They've been so detached by that point that they are challenged with forming attachments. And so, host homing is different than foster care. It's a little more of a less parentified arrangement and more of a safe housing arrangement. So I'm not sure how old the children are, how to prepare them for that, but really talking with the parents about the precarious nature of working with these youth who have survived on the streets, know how to survive on the street, and at the first disagreement, their impulse is to leave. And so we've had to do a lot of work in preparing parents for how do you keep these kids safe, and they can't have the same expectation of children who have not lived on their own because they see themselves and have experienced themselves as much more self-sufficient. So a lot of it is around the expectations in the home and of the parenting. And just prepare them. I'm not sure about that question exactly what you're getting at there, but I think, the idea of safety is going to be paramount for everyone. And so they have lived for a long time, my guess is, not feeling safe. And so what can you do to ensure that they feel safe and they have input and influence and are part of even selecting the families? So that would help with the safety element as well.
Right. Okay, more and more questions coming in. So another one here says, I agree with keeping children with their families, but I'm wondering if there is work done around working with other trusted caregivers or a caseworker or a mentor to be a consistent source of support, particularly if there's a lot of instability with the caregivers or in the home. Are there good models of this or best practices that you're aware of? Was that clear?
Yeah,
Yes.
I could take this so there's lots of different elements. One thing is the in California, this new child and family teaming. A big part of the child family teaming is to bring families together to the table. That way, the parent has ongoing support, and it also loops in sometimes family members about what's going on in the family. So a lot of times I've had experiences where I've gone to a child and family team, and a parent's sibling finds out what's going on, and then for years is there, and when the parent is struggling, will take the child and bring them to their house, and it's just this ongoing kind of, how we want to do it, raise children within their communities, and for families to get that natural support, the support of their families and their communities, rather than having interventions with social workers, and the like. There's also we also have a peer parent program, so parents who have gone through the system will work with parents and build an ongoing relationships, and then there's some community-based organizations that will stay with the parents even after their CPS case is closed. So there is some work to kind of provide ongoing support. I think that was only one part of the question, but I'll leave it with that, and maybe Amelia, if there's some of the other part of the question you could pick up on.
You should be able to see the question in the Q&A box, so you could have another quick look if you want to. And there's also a follow-up question in the chat box, so we should have a bit more time to cover this. Okay,
All right,
go ahead,
we'll do.
Amelia.
I really love Jen's answer, and I'm just going to emphasize it by saying the two things she said were building natural supports within the family and community instead of paid supports, because they transition, they change jobs, things like that happen, but your auntie is always your auntie. And so that's a really important part of her message. And the second part was that we tend to think about the mentorship for the youth or the consistency for the youth, but if we provided the mentorship and the consistency for the parent, then the youth would have the parent consistently. And so thinking about how can we provide those kinds of supports that Jen described, parent-to-parent supports, and really ensuring parents have what they need to be able to continue to safely parent, because what the child needs is their parent. And so how do we make that possible?
Mm-hmm. Okay, so the follow-up question that links to this in the chat box is from someone asking, well, just a comment you might like to reflect on, saying that someone from the UK, one of our members again, has read just this week a paper saying that there isn't any evidence to recommend any interventions that actually help previously maltreating parents. She said, unfortunately, I haven't had a chance to watch videos for this online event, but doing something to change the system is pretty urgent in the UK too. She then says that there have been some good outcomes for substance misuse in court with parents and infants in a few London boroughs. So I don't know if either of you wanted to reflect further on that. Otherwise, there's another question in the chat box.
I mean, my response, unfortunately, because I'm a direct service provider, I would only have an anecdotal response. I don't know the statistics, but I can just say from having over 300 clients in my life, I would find that not true. I've seen change. And, of course, we're human, so, change sometimes means that we have relapses and things, struggles. But, and we have a drug court in San Francisco, and I find it to be extremely effective. And we've had a lot of good outcomes from our drug court as well.
Never heard of a drug court, so I'll have to look into that. Did you want to
That,
comment
you
on
should
that,
say
Amelia?
a word about a drug court, Jen. Say a word about that.
Oh, so there's a specialty court in San Francisco. So parents who have substance abuse issues will get referred on a voluntary basis. This court has additional support services, and you meet with the one of the judges, not the one that presides over your case, every week. And so you're checking in weekly. You get incentives for when you're doing well, and there's a lot of extra support when you might be having struggles, or if you have a relapse. There's also services for those youth. Special 0 to 5 professional to help with, maybe developmental issues, especially if the child was born drug exposed. So basically an enhanced court for parents who have substance abuse issues.
And those are popping up all over the country and have great outcomes. And there are several models and interventions that have great outcomes. So that feels like misinformation based on what I know about the evidence base. We're still building it, and there's a lot of work to be done still in building interventions and learning more about what works, but there absolutely is evidence that supporting parents does provide the kind of change that we're needing and looking for. And I thought the comment was going to be, there's no evidence for our intervention with children, which is actually true, that the more we do, the worse it gets, or at least as bad, if not worse, and the more we lose our social return on investment, that there are not good proven outcomes when we use the current methodologies of working with kids. So it's with the kids, actually, not with the parents, that we're finding those kinds of outcomes.
Okay, well, we've got one more question in the chat box. So if anybody has further questions, please don't be shy to share them. We've got time certainly for one or two more, I would think. So this one is just a follow-up question on the relationship between foster care and adoption. Is there a separate procedure for foster to adopt and the normal foster care? And can a foster carer whose initial intention was not to adopt end up adopting the child they were fostering?
I'll take it unless you want to, Jen.
No, you have a more broad perspective. Okay.
So sure, you can foster and then decide to adopt without agreeing to it first. That transition can be made. And there are parents who also decide from the beginning that they don't intend to adopt. And the difference is really, social workers wouldn't place, or would try hard not to place, a child with a parent who said, I do not want to adopt, would try hard not to place a child who was really in need of adoption, who was what we call free for adoption, and had their parental rights terminated. So you wouldn't want to place a child who really needed an adoptive resource with someone who said, no way will I adopt. That's really the difference, is the kind of children placed in the home based on the goals of the family. But of course, many families fall in love with children once they're in their home and adopt when they hadn't had that intention initially.
Okay, so without further questions, I don't know if there's any sort of closing remarks. I was going to make a few closing remarks, but with a bit more time, it might be nice to allow both of you to say anything else you would like to sort of share or reinforce to the participants.
No,
put you
I
too
don't
much on the spot.
I was actually taking a second just to look through the chat to see if there's any.
Yeah, fair enough.
But I don't have any.
One thing I didn't think was fully, I couldn't remember if it was answered, was the sort of profile of foster parents in the US. So maybe if there's anything that would stop you from being able to provide foster care. I know this can be a little bit contentious in certain countries where people sort of, I've seen things like capacity to bear children being listed in foster care criteria before, which was very strange. Yeah, so is there anything sort of distinctive, anything that would really exclude you from being a foster carer in the US?
I'm sorry, I'm having a hard time hearing you again. Is there
Oh,
anything distinctive about the last part you said?
anything distinctive about sort of foster care criteria in the US? You know, anything that would really preclude you, stop you from being able to foster a child in the US?
Sure. Yeah, I mean, criminal history would preclude you from a background check. For sure that would. Housing instability or financial instability is also looked at quite carefully, and any history of crimes that were, you know, against other children or people. So those things for sure. But did I hear you say the question about folks who are having trouble having children of their own?
It was just an example of some rather strange criteria I've seen suggested in other countries. So, you know, it can be interesting to see what is a preventative factor in a country like the US, because it sounds like, you know, they're fairly top line things, you know, stability, capacity to be a stable home, and then the criminal dimension.
Yes, I mean, what you're talking about around infertility, I think folks who do adoption look at more carefully. Are you trying to create a home for a child or a child for your home? And so are you entering for the right reasons? And so that definitely gets looked at with more scrutiny in adoption, less so in foster care. And so, you know, those are definitely things that, that would preclude. You know, as you heard in the beginning, there is a woeful shortage of homes, and so there's not a long list of precluding factors outside of the background checks and reference checks, and, you know, the kinds of things to make sure the home is safe. And I think another thing in my closing comments, just kind of switching gears, is that we have a lot of resource on our website, free for download, at Alia, A-L-I-A, innovations with an S.org. And we've done a social return on investment study there about the public dollars we invest in, what return do we get. We have an evidence brief around the evidence against family separation, why it's important to preserve families. We are working in jurisdictions around the country trying new ways of work, and we're just ready to release in the next couple of weeks our year one report, which is showing a 12% reduction in foster care numbers and 37% reduction in residential care numbers across the 5 jurisdictions, which represent 14 counties, with no new money and no new laws and no new resource, really by changing people's minds and hearts and doing the work differently within the current funding, within the current laws. So that will be out soon, and the lessons learned on that as well.
Yeah, and I think your website is really interesting in terms of, you know, sharing how you've developed some of these ideas around the unsystem as well. So that's also really worth checking out. Okay, well, thank you, Amelia and Jen, for the really interesting discussion today and all your efforts putting into it. I mean, from my perspective, I'm really interested in this idea of the aha moment on how we change hearts and minds to prioritize family-based care and family strengthening throughout the system and in a kind of more organic way, as well as this question of, you know, are we looking at supply or are we looking at demand, and kind of getting people to really think that through when establishing and changing systems. Also this idea of sort of mentoring parents and building in the natural supports, and this sort of, you know, these sort of groups of people who are sort of just setting up the non-licensed foster care to meet these more severe needs, just sort of taking it into their own hands. It's quite exciting. And yeah, and also just this move towards not distinguishing between the kin and the non-kin, and trying to have a more of a sort of adoption focused look at the beginning stage of arranging foster care.
Yeah.
And then finally, I love this point of the more we do, the worse it gets, which, you know, is scary, but, you know, let's be honest about those things, and let's sort of put that information in the hands of the people that can use it. So really, really inspiring discussion, and lovely to see you both chatting between yourselves about how things are working. So thank you so much.
Yeah,
Thank you.
my pleasure. Thanks, Jen. I think it's just so fun to hear the kind of leading edge in California too. So appreciated doing this with all of you.
Excellent, excellent. So we'll have
Right.
some closing poll now. So people can give a bit of feedback on the event, and we'll make sure that the information from the event, the recording and the other documents that Amelia has mentioned are up online very soon. Okay, thanks a lot.